Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. I hope you're all doing well. Today, we have a lot of great information to talk about, some great studies. We'll be taking your calls here, 888-420-9272, and to all our friends out there in the social media world, Instagram, Facebook, TikTok, Reddit, and all of the others. I know we have about 20 platforms. Rumble, 20 platforms that we're sending information out to. And thank you so much for texting us and emailing us. Lots of emails to the office over the past couple of days. So we have a lot of great stuff to talk about. First, let's chat a moment about a week or so ago, we were talking about the idea, and again, this is not my idea, that when people get married, men tend to gain some weight. And we were taking this very comfortably, very lightly. Over the course of the last week, I had so many patients comment, men and women. The comments seemed to be a little different on each side. We had some calls to patients that we're doing telehealth calls with, and it was pretty interesting, very funny. So for most of the men, they're like, yeah, I gained weight. And of course, they think they're doing the same things that they were doing before, and maybe eating a little bit more, but the wives are saying the husbands got lazy. They're not doing anything, no exercise, not doing things around the house. I said, look, okay. I said, I'll never bring that topic up again, except today. And you guys have to figure out how to work this out, cut back on the carbs, do a little more exercise, check your hormone levels, because that's, a very good part of the picture. But this is one of those things that I think the comments are just going to go on and on and on, but in a nice, happy, fun way. We want to try to help people out whichever way we can.
Dangerous territory.
So, you have to walk very carefully in that topic without making someone feel upset. As I mentioned, I think that, men, when they're single, they just don't eat well. They just eat whatever, junk food, and they'll eat whatever they can get because they don't typically like to cook that much. Of course, that's not every man, and when they get into a scenario where there's amazing food around the house all the time for the women who love to cook, etc., or a lot of people go out to dinner, that could be a reason for, gaining weight. But a hormone decline, decrease in activity. There are a lot of parameters, so it's curious to see how far this will go, and I think it'll go on for a long time. So some great research on red wine and polyphenols in red wine, and really dramatically improving health. This has been known for a very long time, but this is a great study, and published in Molecular Biology and a few other journals, National Library of Medicine. Talks about the benefits of red wine and the polyphenols and many different compounds in red wine. There are a variety of different things, 50, 60 different things in red wine that are beneficial. And I'm just going to read a little bit from here so it's cohesive. Due to the development of highly sophisticated analytical devices, now it's possible to characterize the structure of highly polymerized polyphenols to obtain a full spectrum of the polyphenol profile of red wines. So these are things that are naturally in the grape that are enhanced by the processing of the grape, the crushing, all of that. Flavonols called catechin, stilbenes, transveratol, quercetin, gallic acid, all very, very good and important for your health. They have anti-inflammatory, anti-carcinogenic, and cardioprotective properties. So if we look at the history of wine, and it goes back to 6,000 years or so, and the earliest components in the Etruscans, which predated the Romans, we look at Greece, all the Mediterranean, look at Egypt. This is how wine started and spread around and came, to fruition. The European species, Vitis vinifera, and the American grape species, Vitis labrusca, are the ones that predominantly are made today. And there's a pretty cool process of how wine is made. And I learned a lot from a good friend, Anthony Cennino, who has Cennino's Vineyard out in Cutchogue. And it's amazing to watch the steps of both harvesting, removing the grapes from the vine, putting them into a destemmer, which a paddle will pull the stems out and the grapes get crushed, go down to a separate tube going into a big vat, and then, of course, the entire process there. But It's amazing to see actually how it's done. You know, if we take it for granted there's a bottle of wine. We don't know what happened or how that started and how the process occurs. So, of course, all the good things, the polyphenols are in berries, red wine, citrus, green tea. And a glass of red wine contains about 200 milligrams of the total polyphenols, which is terrific. While the same quantity of white wine, there's about 30 milligrams. So a very big difference. So the health benefits are far greater in red wine than in white. And if they look at the composition, 5 to 8% catechins, 10% procyanidins, 15% anthocyanidins, and the list goes on and on. It's very important to have these things on board. Now, of course, I think when the studies first came out that red wine was good for you, I know two people, my mom and dad, and then all of my aunts and uncles. So it was a lot of people that said, hey, if a glass of wine with dinner is good, a bottle of wine's got to be better. So the majority of people in my family were drinking a bottle of wine every night with dinner. And honestly, they all lived into their 90s and, have done extremely well as a result of that. So I think that it's good to have red wine. My friend has a wine bar in Oyster Bay called the Audrey, and it's a wonderful place. I stop by there all the time, and he's had some great people, and one of them, his name is James. He's an attorney who teaches wine classes at colleges, schools, and various functions, and he came in, I think it was once a month for about 6 to 8 months and went through everything about red wine, everything about white wine, and all the different processes, and it was amazing to see how this is done. Be curious to see if I can get him on the program and talk about all of this because it was fascinating sitting there with him and, doing tastings and such. But I think it's important to consider having a glass of red wine a day if that's your choice. It's better than all the other types of alcohol, honestly, because the polyphenols, the proanthocyanidins, all of these things. So I think it's an important thing to do. Now, that being said, there is a great store, massive wine store called Total Wine. And they have them all over the country. And the one that I've gone to is over in right where Fortunoff's used to be on Old Country Road. Their prices are better than almost any other place I've ever seen because they're so gigantic. And there's a very nice little Italian guy who walks up and down the Italian and the French aisle. I don't know if you've seen the guy, Frankie, but all of my patients go there because I tell them to. They save a lot of money when you buy wine there. There's some very, very inexpensive wines that are terrific for you that have the polyphenols and you're not spending crazy money. If you want to spend crazy money, you can because they have everything there. But there's a really good wine from Sicily called Nero Diavola, and the price is anywhere between $9 to $20 or so. It's a nice full-bodied red wine, and honestly, people that I've given it to think it's a $100 bottle of wine. They wouldn't know until they find out. So you can inexpensively have some really good polyphenols on board. And, you can mix and match with different foods. That being said, I think that's, a health benefit to have the polyphenols on board. Another interesting topic, talking about probiotics in kefir, helping to fight Alzheimer's disease. And this I came across on the computer the other day, Medical News Today, because I constantly look for interesting things to talk about. So scientists in Brazil conducted a big study looking at the probiotic in kefir, how it might improve brain function. So the evidence is saying it's decreasing the risk of cognitive decline in some people that have dementia. Of course, there are many millions of people that have Alzheimer's disease. The numbers are skyrocketing, in part because of normal aging of the brain, but bad outside things coming on board like heavy metals directly correlate with Alzheimer's, Parkinson's, MS, a variety of those disorders. But what they're saying is you have a good balance of the yeast and bacteria in a symbiotic relationship. And they did some studies on individuals where they did a mini mental status exam. Now, this is a exam where you look at a bunch of different things. You have a person repeat some of the words you're saying. You'll have them try to memorize 3 words, and then 2 minutes later, ask them the 3 words. A minute after that, 5 minutes, and see if they have recall. Draw a clock with perfect numbering around, that clock. And people that have issues, it's not a circular clock. It's all over the place like a Picasso or a Salvador Dali painting. It's just all distorted. They looked at markers of oxidative stress. So in their study, they found that there was a 28% improvement in their mini mental status exam scores after 90 days of being on the kefir supplementation. And they also experienced a 66% improvement in some of the memory tests. It's pretty cool. So at Whole Foods, they have kefir and they have cashew milk yogurt and a variety of great products. Not a bad idea to put some of that on board and see if that helps to improve, your memory. And you could get copies of the mini mental status exam and have someone do that for you just to see how sharp and focused your brain is doing. It's always good to test and try to figure out how you can improve yourself with nutrients. And that's, of course, why I've always done the comprehensive medical nutritional approach. So being a physician for 39 years and in practice for all these years, 37 years, I think at this point, we've always looked to test for vitamins, minerals, hormones. Hormone decline changes brain and organ function. Vitamin decline, same thing. So you want to put all these good things on board and get bad things out of the picture. That's why we test blood and urine for heavy metals. So just a little bit of a tidbit on that. So 888-420-9272. If you'd like to call in to ask a question, you can do so now. Garden City office is 516-794-0404. Website is drcalapai.com. And we'd love to hear from you.
The chat is, you got the chat split, Doc.
Uh-oh.
We're on wine. Let's start with the wine. He said, this is Rumble. He said, look, Doc, I don't buy into all these wine is medicine headlines. Isn't alcohol still a toxin? How can something that's technically poison be good for you?
Well, you have to understand that in modest doses, things can be safe and healthy for you, and that's what these studies show. This is not the first study on the polyphenols, proanthocyanidins, and all those good things in wine. So when you have thousands of studies that say the same thing, that there is benefit. But I'm not saying you should drink 10 or 20 drinks a day. I mean, alcohol, as you go beyond the modest amount, can be a problem. And again, this is just red wine. So it's not as strong as all the other hard liquors that don't have the polyphenols or the benefits. So that's why they're saying a glass of red wine a day or a glass of red wine with dinner could be beneficial. You just can't overdo it. So yeah, for some people, taking too much wine or too much alcohol is a horrible thing. So I don't recommend that at all. If you want to have a drink here and there, that may be fine. But I think you're better off having a glass of red wine.
And then we got the other side of things. Hey, Doc, I drink a glass or two of red every night. Cabernet is my go-to. I feel great. But
okay.
My wife keeps telling me I'm overdoing it. Be honest. Am I helping my heart or just making excuses?
Well, you're putting polyphenols on board, just as we mentioned, so there is benefit to that. I don't think by having 2 glasses of wine, you're going crazy. And the doctor side of me always says, well, what are your vitamin levels? What are your mineral, your hormone levels? If those are good and your liver, kidney function, and all your other functions are good, then I don't see that as being a big problem. So it has to be taken into a more full context to make sure that all your other parameters are good, that you're doing some exercise every day. That just makes your body healthier and stronger.
All right, to YouTube. I've tried to follow a clean diet, no processed foods, low sugar, and I've always skipped alcohol. But now I'm wondering, am I missing out on potential benefits from red wine? Should I actually start drinking it for my health?
I don't see a problem with having a glass of red wine a day. Again, based upon tons and tons and tons of studies. So.
I love this. All right, we got another one. I have 2 toddlers. I've been using a glass of red at night to help me. Oh, I thought I was getting nervous.
I was going to get what?
Just gets them quiet. Kidding. I lost it. Okay, 2 toddlers. I've been using a glass of red at night to help me unwind and fall asleep. Is that harmless? Or am I messing up my sleep more?
Well, it depends upon the size of the glass. I've seen memes on Instagram where I just have a glass of wine a day, and they show this gigantic glass that's
the whole
gallons and gallons of wine. So, yeah, I don't think that's a problem. Very rarely do we see people that might be allergic to grape, but that's super rare. And I think if you're getting the good polyphenols on board and, you're having good sources of wine. The other thing we have to comment on is that there are probably 30 vineyards that were under investigation for arsenic in wine in California. I'm not saying the high-end, expensive California wines. I'm not telling people you have to go out and buy that, but go online and look at California wines and arsenic and just make sure that there's no arsenic in the wine. I think to some extent either they're putting, chemicals into the field so that you're killing the germs that the grape could be damaged by, just like they put arsenicals into chicken feed so chicken don't end up getting sick, etc. But then we end up absorbing that. And even then, I have to tell people, you got to test for heavy metals through blood and urine, see what your body's exposed to from all sorts of things, not just potentially wine. So the Italian and French wines don't do that. And there are things on the label I learned from James, our wine teacher, who taught the wine courses, that if you see DOC or DOCG on the label, typically of the Italian, in the French wines, the same thing, that's the highest level of observation and scrutiny of that wine. It's tested throughout the entire process to be the best of the best. So if you're looking at French wine, the other thing he taught us was that if you see multiple areas or lands or regions on the bottle, the more names of towns and lists of where the chateau is, that's the highest level of production of wine. In the U.S. and South America, they talk about the grape. Over there, they don't talk about the grape as much as they put down that this is a wine from France, it's from Burgundy, it's from this area, from et cetera, this chateau. The more outline you see there, the better the wine. So, little tidbits.
Crazy. And you basically answered this question that was also asked, which, I think is very interesting. Said, I love the taste of red wine, but I always get a stuffy nose and sometimes a headache after a glass. Is that from the sulfates or something else?
Typically from the sulfates. Yeah, so you'd want to get wine that don't have the sulfates in it.
Yeah, so, and I'll just say, after learning from you, Doctor, the difference between most California wines and anything coming from Europe, other things, the labels, me and my wife will be at like a wedding and they'll give us, the only thing available is a California wine. Mm-hmm. And I'll have 2 glasses. And the next day I wake up, I said, why do I feel like I took down 5 bottles and a train hit me? Yep. And there it is. It was so obvious.
The rigorous standards are not here compared to there. So the European, Italian, and French standards are very, very, very strict. There's another interesting comment, and I'm going to have to call James because I like to chat with him every now and then and ask what his favorite, what's coming up or coming out. Just like the Wine Spectator has all these numbers, 97 points or 99 points. I've had a couple of wines through my friend and a couple of 100-point wines that were spectacular. Of course, he can afford the crazy price of the 100-point wines, but it was just like nothing I've ever had before. But yeah, if you feel bad during or get congested or you feel bad afterwards, you're not getting something that's as good as or that may have the sulfites in it, so you're better off avoiding all of that. There are lots of natural things to put into the soil that are great for the grapes and that may be bad for some of the things that might damage the grapes. As we spoke about this last time when we interviewed Anthony, that some of the minerals and magnesium and potassium, prevent some of the damage to the grapes, but they're wonderful minerals to have in the soil. So
it's also wild to just, I got to check out Tuscany and like these different hills, and they'll be like, you'll see one, grouping of vines, and they'll be like, okay, these ones go for this price, but this one, look at the location, look how much more sun it gets over the day. That's $1 million, $1,500 a bottle. It's crazy.
It's a world of difference when you start to look at all the things, the different characteristics that create the end result. So there's a terrific wine in California, but up on the hills. And what I was told is that the vines struggle a little bit more because they're higher up, maybe less oxygen. That means they're trying to get deeper, better roots. They're sucking more good stuff from the soil. And with more sun, etc., those wines happen to do much better. They're more stable, and some of them are super expensive because they're just a totally different, chemistry, natural chemistry in the wine. Yet others grown in relatively cheap soil or soil that's not terribly well enhanced with nutrients and all the good things, the natural things, or if there's not enough sun and enough rain, you're not going to get the same product. The interesting thing, too, is that in Europe, they grow one grape on a vineyard, and that's their specialty, and they've been doing it for, who knows, thousands of years. They don't grow 20 grapes to try to get to market with all these different things and blah, blah, blah. They typically grow 1 or 2 grapes whether it's in Burgundy or any of these, facilities in Champagne region. So same thing with Italy. But as I tell people, go to Total Wine. You'll get your best price there. See the little, I forget his name, little Italian guy, and have him show you different varieties and different bottles of different things. If you don't like sulfites, tell him you don't want sulfites. So it's fun.
I love it. And there are apps where you could actually scan. We'll get them for the next show, but there are apps where you can go looking for wine and you just take a picture of that label. It'll show you everything in it.
Yeah, Vivino. Vivino is great because you could take a picture of the bottle and it shows you everything about it. So it's a great way to get a little education on the wine.
Yes, we got a question on TikTok from someone who's doing keto. Said, I'm doing keto right now, strict. Can red wine fit into a low-carb lifestyle, or is it a total sugar bomb?
No, it can. White wine's got more sugar. So certain wines have more sugar than others, and certain alcohols have more sugar than others. But having a glass of wine is not going to interrupt your keto effect. It's things that, like grains, that will sit in your gut for hours and hours and hours and constantly release sugar all day long into your body, that inhibit your body's ability to reach the fat to burn it as a primary fuel. For some people who want to work out and they'll have some fruit before the workout. Well, fruit is not a day-long exposure to sugar. Your body will absorb it, and when you work out, your body will burn it. So for a lot of people, I'll tell them, if you're dying to have some kind of fruit or carb or something along those lines, do it right before you work out so your body burns it and it doesn't affect you.
We got another one from TikTok I just think it's funny. His name is The Overthinker, and he's overthinking. I'm just wondering if the benefits are from antioxidants in the grape skins. Couldn't I just eat grapes and skin the wine altogether? Skip the wine altogether.
I mean, you could. The only problem is, you're getting more direct sugar from having the grapes. So for some people that want to stay away from the sugar. So, and also some of the processing of the wine, according to the study that I read, also enhances the polyphenols and the proanthocyanidins. So you could do it a variety of different ways.
And then we just have a viewer who switched from beer to red wine 2 months ago and has lost 30 pounds. 30 pounds.
All right. So that's a relatively common phenomenon because a lot of people that drink beer with the calories, the fermentation process there, sometimes they have more bloating, indigestion. Maybe that indigestion is inhibiting the absorption of vitamins and minerals. So I wouldn't be surprised. There are people that have non-alcoholic beer. I'm not sure the components of that. If it still has the same malt, barley, and hops, which are higher, sources of sugar or carbohydrate. And then there's, Miller Lite or, there's some of them that have very low carbohydrate, but it's really all about carbohydrate. And there's nothing in beer that's going to protect you like the polyphenols that are in the wine. So,
yeah, beer is. I went to a couple of breweries. I'm like, oh, this is nice. I could bring my dog, just have a couple, and it's like, I'm getting some itchies, I'm getting some rashes.
Yep.
Yeah.
There are more people that react that have allergy mechanisms to grains and such, and reactions to beer that we've seen in the office than those people have reactions or problems with wine.
Oh, we got one on the probiotic claims. Said, I'm skeptical about all these probiotic claims. Is there really research showing that probiotics can actually slow down or help treat dementia?
This study that I just talked about in Medical News Today, you can read up on that. And you could also, and I tell every patient, go to Google Scholar, which is the easiest search engine, and put in probiotics and whatever topic you want to look at. Are probiotics beneficial for gut problems, indigestion, ulcers? Just, you could look at a list, and faster than I could explain these things to you, you can get on there and look at probiotic benefits. And Google Scholar is really all medical research. So it may take you a minute to read the abstract, which talks about how the study was done and what they're looking at. And then in the bottom of the abstract paragraph are conclusions, and you'll see a ton of literature there. The suggestion is that everybody should have probiotics on board because they just help your body stabilize and balance the organisms in your gut, but also help you to break down foods better.
Yeah, I just went on to Google Scholar. I just searched probiotic Alzheimer's disease and, 28,000 results on that.
Yeah, so, and I tell every single patient at every visit, if I didn't tell them on the first visit, but I usually do, go to Google Scholar and start looking at things. You'll be amazed. And some people might be up all day and night looking at articles, but so it's a good education. I do it.
Yeah, we have one from Instagram, and it says, I've seen a ton of probiotic supplements for cognitive health. Are some of them really better than others? Should I be focusing on specific strain, or is it all just marketing?
It's hard to say. There have been studies that talk about different strains of probiotics, the lactobacillus, acidophilus. That's one that we've heard, forever. Saccharomyces boulardii is probably a better one. That also helps to stabilize the gut, but there may be hundreds of them. I'll have to do a little bit of research and see what literature says, are the better types of probiotics to improve your function.
And then just a follow-up from that same person said, I eat a lot of fermented foods, yogurt, kimchi, kombucha. Do you think that's enough to get the brain benefits of probiotics, or
We'll have to look at those things individually. I haven't scanned and looked for, kombucha, each of these individual or kimchi, looked at correlations there, but that's certainly something that they can do. And if they want to call back and tell us, you could do that. But I think all the most natural things are the healthiest foods for you to eat. I don't see problems with those foods. That they're probably beneficial, but I can't quote a study until I take a look at that.
And we have a question just asking you to explain the gut-brain connection.
Oh, boy. It would take a lot of time, but I'll go over some of the basics. As I've maintained forever, the gut is the doorway into your body. Without breaking down good components of food and without getting vitamins and minerals into the bloodstream from your gut, without killing germs and bacteria in your gut, if that system is not working right, that'd be a problem. But every part of your body relies on the gut to absorb vitamins, minerals, which are meant to make antibodies, which are meant to make neurotransmitters and hormones. Everything starts there. So if you're putting bad stuff in, you have to expect bad result. Putting good stuff in, good result. Testing for your vitamins. Looking for food allergy to see whether or not you should keep certain foods out because it's going to create a problem. Yeah, everything starts with your gut, and then the building blocks of your hormones and your proteins or fat and your antibodies are proteins and fats. CoQ10 is important. Everything is important. So your neurotransmitters depend heavily on the food that you're eating and your nutrients, your vitamins and minerals, and of course your hormones. So that's the easiest way to say it. And I can clearly tell you in thousands of patients, when you start to fine-tune the diet, get rid of the junk food, people say, wow, my brain fog is gone. I'm sharp, focused, great word retrieval, speed of thought is there. And they didn't have before because they're just putting junk on board. And then if you correct hormones that may be deficient, they'll do even better. We talk about using NAD, nicotine adenine dinucleotide, greater brain function. So your body has parameters, it has requirements. Get out the bad, put all the good things in, and watch to see the change.
Right.
Once again, 888-420-9272. If you'd like to call in to ask a question, you could do so now. 888-420-9272. We've got an email from a gentleman, Tim, who's a golfer, and the season is upon us. Has some issues with his elbow. Typically, golfers have a medial epicondylitis because the way the swing occurs and that sort of snap and turnover when you're hitting the ball on the tee or from the ground puts pressure on the ligaments and tendons at the medial aspect of your elbow. So you can palpate it. I can press on it and see where the pain is. If we need to, we can do an MRI to see if there's any fraying or damage of those ligaments that hold bone to bone or tendons that go from muscle to bone. And in many cases, that's what we see. It happens with tennis players, but that's usually the lateral epicondyle because of that backhand and that torque and twisting over. So some of the simpler things that we can do for that, prolotherapy is one of them, where we take vitamins and minerals and inject into the area to try to stimulate a response to get your body to go there and create some healing. That is good, but it's a minor stimulus. It's not going to be there a month later. So sometimes people will do a prolo once a week over the course of a few weeks if it's mild. If it's more than mild or if it's chronic, then we typically go to PRP, platelet-rich plasma, where we take your blood, spin it, and we're collecting 7 growth factors. And those growth factors that we now have in the syringe, we could inject into that area to create more of a significant benefit. It'll last about a month. There's a difference between what I would call different types of PRP. And it's not as though they're different growth factors. That's not it. But most doctors use a simple centrifuge like the one to spin your blood and are given a free centrifuge by the companies that you buy the PRP kits from. Now, even at the best of those types of kits and centrifuge, you're getting about 3 cc's of PRP. And it's going to be blood tinged because it's not spinning fast enough to just separate the red blood cells out. Some people with that red blood cell in the PRP will feel soreness. You don't need to. But since all the years I've done stem cells, we have a 4,000 RPM centrifuge, which is super fast, we're able to get pure PRP in 10 cc's of pure straw-colored PRP. So it's dramatically better, greater, and we could put more of it to certain spots or multiple spots, and you get a better outcome. So that has been sort of the hallmark of those moderate wear and tear medial and lateral epicondyle issues. For people who are worse, then we opt to do stem cells because we take your own cells from your body, spin them, and as you inject them to the area, they colonize and divide. And that's why you get a far greater duration of time to create the repair over the course of a few years. So that would be, those are the 3 options that you have, depending upon how much wear and tear you have, is what we would choose to do. Interesting comment, too. I was talking to Frankie before, and I said, we did stem on my mom a few weeks ago, and mom's 95, and she's doing great, healthy as can be.
This is wild.
So she called the other day, and she said, I'm seeing something a little bit different and unusual. I said, what? She said, the whitish hair and the grayish hair on the side of my head, the temples, is now all dark. I went to see her yesterday, and I was shocked to see that her hair is all dark. She has salt and pepper hair throughout, doesn't color her hair, but now this hair is dark, as if someone took a coloring and just ran it through that one spot on both sides. And I took a picture of it, so I'm not going to show it on camera here, but maybe I'll have my mom come on the program. She might love to chat, but I'm worried that she'll say some bad stuff about me.
Well,
I was a bad kid when I was young, so I got to be careful. We had to put the mute button, very carefully on standby. But no, yeah, her hair's getting dark. Her focus, concentration is great. She's riding the exercise bike 30 minutes in the morning. Sometimes she'll do 45. One day she did 57 minutes on the bike, which is spectacular. I don't know anybody that's 95 that has ever done that. So pretty cool stuff. And we have a few other patients. One of them who had a neurologic concern, and first name is Martin. I spoke to him. I saw him the other day. And now he can walk and function up and down, all around, not using a walker, not using a cane at all. His function balance is great. And that's only a couple of months after the stem that we had done. Another gentleman had problem with his knees and his back and walking, and same thing. He's doing dramatically better. We have a few more diabetics that our blood sugar is dropping significantly. So as we get them to be non-diabetic, we'll probably interview them and pop them up on the camera here so they can talk about their story.
Got one from Reddit real quick. My husband's starting to get forgetful, and I've read probiotics might help brain fog or mild cognitive decline. Is that worth trying, or is it too early to?
It's hard to say. One study on the benefit of the probiotics from kefir was talking about that, but I'd rather, to be thorough, evaluate and see exactly what's going on. Look at vitamin levels, mineral levels, hormones, heavy metals, because they'll absolutely cause damage in memory, focus, concentration, dementia, all sorts of things. So I'd rather look at the entirety of the picture, and we could recommend, and we do recommend probiotics, but I don't want to miss something. If the heavy metals and aluminum is high and that's causing the damage, the probiotic will never help. If the hormones are low, probiotic will never help. So it has to be a thorough understanding of why the problem's there. That's why we test the big blood test. That being said, a little comment on the vitamin recommendations, because I've done this with every patient I've seen, in all of these years. I have a new idea about recommending vitamins to make it cost effective, make it easier, rather than people going out buying bottles from all sorts of places or even one facility, not knowing what to get, how much to take, milligrams, dose, all of that. And after doing this with so many patients, I'm going to make packs for patients specific to them. So the way that this would work is that if I see your blood test and I know you have heart disease and you're diabetic or something, then I'm going to make a morning pack and an evening pack. In the morning pack, maybe 2 multivitamins, maybe a couple of chromium to help to stabilize the sugar a little bit, a vitamin D, maybe CoQ10, 3 CoQ10 if they're a cardiac patient in the morning, maybe 3 in the evening. So I'm going to be able to put together vitamin packs specific to that person, which would probably be different than everybody else. But the ease of this would be to get a box with your name on it, a list of the vitamins, and et cetera. And you take the morning pack and you take the evening pack. You go out to dinner, you take the pack with you, take it while you're eating, you're set. No other confusion, no this, that, all over the place. That I will figure all of that out and set that up for you based upon your recommendations and your history. And then month to month, we could change it if need be. If you need more of this or less of that, we can do that. So this will be the custom way and the greatest way to be able to correct your vitamins and to keep them in that perfect range. So that will be starting over the next week or so.
Let's go. We got a question, just a general explanation of what kefir is. Some people have heard it for the first time today.
Kefir is a combination taken from milk and non-milk sources that has a combination of different substances in it. It's got probiotic, and it's been around for centuries. Obviously, kefir has been used in the Middle East probably close to thousands of years. And the probiotic components of it are beneficial for your brain. I'm trying to look to see what... And there are different types of probiotics in the kefir. This doesn't outline the exact components in this study. And that was recently published. But it's a combination of different probiotics with normal bacteria and the yeast to be able to create that underlying result. But I'll try to get online and look at the different components, but every company may make something different. So we'll come back and we'll talk about that more maybe on Friday or Saturday.
Sounds good. And we got this one from Reddit as well. It said, hey, Doc, dementia runs in my family. I'm doing everything I can to stay sharp. Would adding probiotics actually make a difference if I'm already living healthy?
It's hard to say. Based on the study, the comments are yes, but I don't know what may be contributing to dementia in your family. You know, if your whole family has that, then there's something more than just, a deficiency of a probiotic or kefir. So especially if there's a strong family connection, I would look to see why that's occurring. And for some people that will try different things on their own, to some extent, what if something is creating the problem and you're not getting the eval done and you're wasting a little bit of time by trying something that may not correct that cause? So anybody that's got it in the family, anybody that starts to have problems of focus, concentration, you forget where you put your keys, where your glasses are, although a lot of times they're on a person's head, you want to learn about what's going on in your body. And certainly you want to do blood and urine for heavy metals, because heavy metals are the worst things you could have in your body because they cause damage straight throughout and all across the boards. So heavy metals linked with a variety of cancers, MS, Parkinson's, Alzheimer's, all of these things. So I would rather look at the entire picture, and that's, of course, what we do with our blood and urine testing, and then make recommendations to create correction. I just wouldn't want you to go on trying something, and maybe something else is creating the problem that you're not fixing.
All right. We got a question on the Mediterranean diet. I've been following it pretty closely, and I've read that a glass of wine with dinner is part of it. Is that actually a health recommendation or just a cultural tradition?
It's interesting how many cultural traditions throughout the world are far greater than the typical Western diet that's been thrust on us, over, generations. So people use a lot of olive oil. It's great for your body. We even tell people to take a tablespoon of olive oil once or twice a day. If you do it on an empty stomach, it's great for your stomach. There's evidence that it helps to kill bacteria in your stomach, including Helicobacter. There's evidence of the polyphenols and the parenthocyanidins in the red wine. So, yeah, that does make sense. And if you look back at history on all the populations that have existed worldwide that didn't get caught up in the contemporary junk food world and stuff that has become popular here, more so here than other countries, their food has been great. There's no chemicals. There's no preservatives. Every time I've traveled, all over Europe, you see people growing their own food. They're controlling the soil. They're keeping all the good minerals in the soil. I've had patients from the Caribbean. One woman that I think of and talk about all the time, she lived to 103. Actually, when I saw her, she was 103. So I'm sure she lived longer than that. She was from Trinidad. She had all her own vegetables that she grew. She had chickens for eggs and meat, and she had goats for milk and stuff, and she was phenomenal and didn't have a wrinkle, on her face at all at 103. So, and she's in a heavy-duty sun environment. So people that have been eating that way for centuries and centuries, and really thousands of years, have had better food in their diet than contemporary westernized diet. So I think all of these things have been proven to be a great advantage. Not the chemicals in the food, not the GMO stuff, all of that. All the stuff that ends up here, that is allowed here for the time being. Of course, our favorite RFK Jr. is doing a wonderful job. I love the stuff that he talks about, what he says. All of those great things that generations have had in other countries are definitely healthier than here.
I already got a couple wrinkles. I'm 30. What the heck?
Yep.
I got to move to Trinidad? All right. All right, what do we got here? Hey, doctor, my sleep tracker shows I get worse sleeps on nights I drink wine. I thought red wine was supposed to help you relax. What gives?
I mean, to a certain extent it can, but I don't know how much you're drinking, and I don't know. For sake of discussion, and this is the way my brain thinks. It may be a little bit bizarre, but when people come in and things don't make a lot of sense, I have to figure out why. If a person's not sleeping well, maybe because their vitamins are low. And maybe their vitamins are borderline, and then when you're not drinking, your vitamins are okay, so you're sleeping better, and when you're drinking, you're wiping out some more of the vitamins. Maybe. We've seen that happen in people. Maybe your hormone levels are good when you're not drinking, but if you're drinking a little bit, you may be knocking down your hormone levels. That can happen. As people get older, your hormones decline naturally because your organs are making less new cells, therefore less hormones, less neurotransmitters. Interesting thing, when we start to correct IGF-1, which is the active component of growth hormone, which every person that's ever lived has had in huge amounts, being from a child growing to a adult in 16 to 18 years. When the IGF-1 levels drop, people don't sleep as well, their memory focus, concentration's not as good, their hair, skin, nails change, endurance, strength with exercise changes. So if we talk about people that are at the borderline for one of those hormones and a little bit of the alcohol or too much of the alcohol is affecting that, then that could make it worse. So this is the way that I think in terms of why is your body doing something or why is your body going through this? And of course, the blood test for all of these things helps to figure that out and pinpoint it. So that may be part of it. I've seen that before.
So we have someone on Reddit that just says, I noticed my sleep quality gets better after strength training days.
Yeah.
Does that have anything to do with IGF-1 levels being higher?
Probably. So people don't have this idea in their head until I explain it to them. So you could be sitting in one room with another person or sitting in a room alone. Let's say that room is one cell of your body and you have 100 trillion cells. You inside that room, if you're a worker inside that cell, need to be fed. You need oxygen, lots of oxygen, vitamins, minerals, hormones, everything good to do your best job in that one cell. And you need stuff to be taken away once your cell creates its metabolic activity. So we've known forever that exercise, both cardio, of course, and weight resistance training enhances blood flow. What does it do? It delivers all the great stuff everywhere through every blood vessel, large and small. The exercise will also pump lymph channels to help to pull things away from your cells and get rid of waste products of metabolism. You'll get them out of your body through, obviously, the two different ways, through urination and defecation. So exercise is always good for your body all the time. I'm not talking about someone who's got a torn meniscus and, is pushing himself too much. We want to fix your meniscus, and that's what we do with stem cells. But if I can fine-tune and correct and perfect your vitamin and mineral levels and your hormone levels, and you're doing the exercise, invariably the people who do that will say, wow, I feel 15 to 20 years younger, because they're regaining their energy, their endurance, their strength, their stamina, sleeping better, digesting better. Every component, mood is better when you do the exercise. So if you put all those things together that you had years prior, 10, 15, 20 years, whatever the number is, whatever age you are, your body will always do dramatically better with that combination. Absolute. Positive. No argument. So that's, what I do all day, every day when we talk to people. I talk to people about all of that always. Yeah, there are other things you might do, test for allergies, may do vitamin IVs, you may do stem cell therapy, but everybody gets that full-blown discussion and the analogy of the one room being a cell and the need for all of your vitamins, minerals, and hormones.
Wild. We have a question from Instagram. It says, I use a wearable, I guess a device, a wearable that shows my REM and deep sleep levels. Can I actually tell anything about my IGF-1 from that data, or do I need blood tests?
You can't correlate IGF-1 from that, so it's a blood test because it'll tell us exactly what you're able to make. Any chance you can tell us what your age is? Let's see if we can get that. So your IGF-1 when you're born up until you're 18 could be through the roof in the thousands, because it's got a job to do to create and make new cells everywhere, and just to create your height and help with organ production, all of that. Those people that are very tall basketball players have a lot of IGF-1 because their bones will grow and they'll be super tall. And by the time their bones close, they're already super tall.
43.
Okay. So at 43, you're already in the decent decline of IGF-1. Some people will drop in their 30s. Most everybody by the mid to late 30s and 40s has been dropping a good amount. So your level could be 100 or it could be 50, and you want to be close to 300 for that. So if we correct the IGF-1, where you take a little tiny injection into the skin of your leg or your belly with a tiny little, like a Botox-sized needle, like the hair of your eyelash or eyebrow, and you get your levels up, you'll see all those things: memory, focus, concentration, endurance, mood, strength, sexual drive and function, sleep, hair, skin, nails, all of these things. And it's routinely all of those things improve because we have people track, every one of those parameters as we put them on. So it could be a very big difference. If you're 25 or 30 and your levels are 280, you're not going to see the difference. I mean, we wouldn't recommend it, but as you get older and your levels drop, you want to walk it back to where you were 10 or 15 years ago. That's part of our anti-aging protocol, where we talk about why is your body doing what it's doing? Is your body aging faster than it should be right now, whatever age you are? And then let's go back and correct your vitamins, your minerals, your hormones. We talk about IGF-1, testosterone, estrogen, progesterone, bioidentical, NAD, which can work extremely well. And then always the exercise. It's a whole orchestra. You're not going to play this magnificent symphony number without having all of the orchestra equipment and the winds and the brass and all these things. You need everything to be working perfectly.
And we have this one from from Rumble saying, there's so much mixed messaging. Some saying boosting IGF-1 helps with sleep and recovery, and others say too much increases cancer
risk. There's no such thing as too much, and there's no study that says IGF-1 causes cancer. So what people typically do is they look at something that someone said, or they hear something, and they run with it. But there's no evidence of that. Remember, I'm on the computer every day looking for evidence of everything. Years ago, a study came out of, I don't know if it was Finland or one of these facilities, that was a poor research facility. They didn't know what they were talking about. They said beta-carotene can cause cancer. I said, that's insane. When you look at the study, they looked back at people that had cancer and saw if they had any beta-carotene on board. That's not a study. That's stupidity. And there weren't people taking tons of beta carotene, and their beta carotene levels were so low that it wasn't really going to help them because they didn't have enough beta carotene. And you look at big studies about beta carotene and vitamin D decreasing risk of cancer, then you know that one study was foolish and was just made to look like beta carotene was bad for you. And they do that every now and then. When great studies come out about vitamins, some facility makes a study look like, oh, vitamins are damaging or dangerous. I've seen this every year for 37 years. So
wonder who's paying them.
Yeah. So your own IGF-1, you had lots of it your whole life up until probably whatever recent age. All we're doing is testing you and giving you a little bit more, same as what you had 5, 10, 15 years ago. Not bottles a day, but tiny amounts, microdosing per day to create the result. So that's the only safe way to do it. There's no mixed message. There are people out there saying, oh, yeah, don't do anything because it'll cause cancer. And you hear that with every vitamin that's ever been recommended. But the overwhelming number of studies on vitamin D are 4 million studies. None of them say vitamin D causes cancer. They say it reverses cancer. Similar to vitamin C, 4 million studies. So the overwhelming literature is there proving the safety. And every now and then you get just someone to say something that doesn't make any sense.
We just have one that says, my teenager sleeps like a rock, and I heard that's partly because of high IGF-1 during growth spurts. Is that true?
Yeah.
And what happens to those levels as we age? Are you basically
Well, yeah, that's absolutely part of great sleep because research over many years has outlined exactly what IGF-1 does, and that's a big part of it. And every person I've ever seen that's lost sleep, lost muscle endurance and strength, stamina, sexual drive, changes in hair, skin, nails, all those things that I mentioned, whatever age they are, 40s, 50s, 60s, etc., you start to bring it back, and all of a sudden they say, yeah, my sleep is great. My word retrieval, my brain fog's got, they're better and better because you're bringing back what they always had. This is not something your body's never seen, like a cholesterol drug or an Alzheimer's drug or a blood pressure pill. There are places for some of these things, but I like the idea of giving your body back, like your vitamins, what it's always required, what it's always had and always needed. NAD, IGF-1, vitamins, testosterone correction, or even the bioidentical female hormone correction. It's got to be done in a very scientific and controlled way, and you see great results with it. To sleep like a young kid again. Also, remember young kids, even with their growth spurts, what stress do they have? None.
Fact.
What aggravates them all the time?
I got a test tomorrow. Oh,
Yeah.
no. Oh, no. Bring me back.
Yep, the good old days.
All right.
Let's see what else we have here. So
That telephone number.
Kelly has a history of psoriasis, so she thinks it may be correlated with foods because certain foods she realizes and thinks may be making her itchy and bothering her. So psoriasis, in the way that I see it, in many cases is correlated with a food allergy, delayed reaction to a food. And if we test for foods and take those foods out, people get significant improvement. The other weird thing that we see too is that there may be some correlation with a fungal organism or fungal infection. And people say, yeah, if I eat too much sugar or carbohydrate, it flares up. But that correlates with yeast or fungal organisms that may be in the gut. So in many cases, in doing a carb or sugar restricted or free diet, people see improvement. We've also had people that we put on an antifungal pill and some antifungal cream that get even further removal or further dissipation of psoriasis. So I think in correlation with allergy and with fungal issues, that's a great place to start and to look because we've seen results with that. 888-420-9272. If you'd like to call in and ask a question, you can do so now. 888-420-9272. And we'll get your questions up here. Let's see. Rosemary, low back pain, sacroiliac issues since she's had kids, and she's also playing pickleball. Well, good for you. I hope you're not a crazy pickleball person who'll yell and scream. And I saw something online.
It was competitive.
Yeah. It was hysterical. And it seemed like it was a real video, but you never know nowadays because people can make these things because they want to be famous. A pickleballer was screaming at a person on the sidelines because they were talking with their friend in the midst of their pickleball play.
It's insanity.
Okay. So sacroiliac issues, of course, when women become pregnant, your ligaments and tendons are stretched out to accommodate delivery. And we've done, as I mentioned before, 3 different things to help to repair damage to ligaments and tendons. Prolotherapy, it's mild, but this mechanism may need more than prolotherapy. So PRP, platelet-rich plasma, and stem cell are the best to recreate strength, stability, and create repair in those tissues. So for some people, we do the IV stem cell, goes to their whole body. More and more people are asking for that because they want it to get to their whole body. And we may just pepper the sacroiliac ligaments to create repair there. Obviously, we don't charge for that part, but that's a great way to get those tissues strong again. As well, a lot of people are looking at stem for anti-aging benefit and rejuvenation. So in a similar fashion, we would do the stem cell IV. And some people want to do it throughout and across their face, just like people get Botox done to try to relax the muscle contractions so they're not wrinkling. But that's a transient mechanism that can last a few months. But if you're layering stem cells down throughout your skin of your face, you have all these new cells that will constantly keep coming up and dividing over and over again to create terrific results for your face that will go on over the course of years.
The chat wants to know what you mean by peppering around.
Oh, peppering is one of my own little... Actually, there are doctors I remember. There was a terrific orthopedic doctor. His name was Norman Svilik. He was a DO. I did training with him in my internship. Wonderful guy, great personality. And when he would inject certain areas, ligaments, he would say you're peppering it because you're taking it and you're tapping and putting that ligament, putting that liquid or PRP into multiple areas. So it's like saying you're tapping and you end up peppering the area with that liquid of choice to put into the tendon. There was an old school technique called barbotage, which is a little bit maybe archaic or brutal, where doctors would take a needle and just go to where you have damage in a ligament or tendon and just jab it a whole bunch of times to make it a little bloody to try to create repair. And to some extent it worked, but I like to put the PRP in there to create that result. We don't need to jab it to cause damage, but we just need to lay it down. So you're putting it in a variety of different places. So that's probably what peppering means.
I love it. Anyone else? Last call. Chat.
888-420-9272. Let's see what else we have here for emails. Patricia, PMS, especially after certain foods. Well, funny thing is that certain foods have a lot of hormones in them, like, beef. And many women that have beef in their diet, adding to the fluctuation in their hormones, feel worse. And if you take certain foods out, all of a sudden the PMS starts to go away. If you raise up magnesium, potassium, if you're deficient, or calcium, that helps. So correcting DHEA, that might also help because that stabilizes the female hormones. So there are different ways to help to improve upon that. Freddie has problems with muscle weakness and changes in his hair, and the hair on his legs is gone. But that's a testosterone deficiency sign. So the hair on your lower legs dissipating, it means that testosterone's been declining for a while. Weakness when you're doing muscle activity, same thing. But we also talk about IGF-1. There's not a patient that I would look at where we wouldn't test all the hormones. A big 12-part thyroid panel, testosterone, free testosterone, IGF-1, DHEA, all of these things. Because at the age that one hormone drops, the other's dropping too. We're expected to hear that women in their could be 30s, 40s, and of course 50s and beyond have loss of estrogen and progesterone, but all the other ones drop too. DHEA, testosterone is important in women for preventing bone degeneration, osteoporosis, sexual drive and function, muscle response, mood. So all of these are important. We take a look at all of them in men and women. Okay. Pretty much set.
I believe the spring breakers have another week. So
yes, that could be. They're having fun out of town somewhere, hopefully safely. Yes. We'll be back on Friday here at 12:30, Saturday at 2:30. Just spoke again with Dr. Deckel, a good buddy who's been a hormone doctor, gynecologist specialist, does a lot of thermography, and practices between here, I think, and the Carolinas. And we'll have him up on the show in a couple of weeks. Dr. Joe Borascano, the best Lyme doctor that I know, we'll have him on. I spoke to him again. Terrific knowledge on Lyme disease. I've used him as a consultant for many of my Lyme patients. He really wrote the book on how to test and treat for Lyme. No one's got more knowledge about Lyme disease than he. So great to have him come on the show. And we might have one or two famous ball players on the show.
What?
Maybe. It depends on whether you're an M fan or a Y fan. Now, all the M fans used to be D fans, especially my entire family, because they were Dodger fans back in the day. And as you might expect, back in the day, baseball was a religion, just as much as any other religion or any other thing that people thought about, dreamed about, knew everything about. And I would hear my mom and my dad and my aunts and uncles all talk about the guys back in the day on the Dodgers, Campanella, all of these guys. And it was great to hear all of these stories. And then when the Dodgers left, the fury began. And the Dodger fans never really liked the Yankees because the Yankees were a good team. And there are a whole bunch of stories about playoffs and maybe World Series and stuff. So we never bring that up. It's never a topic at, dinner time at home. So the Dodger fans became Met fans. And who wasn't a Met fan back in the day? Back in '69, the Jets, the Mets was spectacular. Going to games as a kid and doing the scorecard thing. A lot of wonderful memories of that. And then over time, always enjoying the Mets, but then having some new friends that were all Yankee fans, started going to Yankee games. In college, my friends and I would go to Met games because we had a bunch of seats. We had season tickets that were all within one area, and we'd watch all the games, went to the World Series. It was a terrific thing. So I promise you a balance. If we have a famous M, we'll get a famous Y. So we're working on that.
Or
right
maybe
now.
one that checks both of those. Who knows?
Yes. We're looking into this, people. If you're a fan, we'll let you know, not necessarily who, but we'll let you know the day of the interview. And might even be able to get someone in studio, but we'll see what happens. But I love the idea of talking to some of the people who really made sports wonderful over the years. And these people that I've spoken to, absolutely. Have a friend who played for the Bears, gigantic linebacker, great guy. He agreed to come on. I had dinner with a gentleman that played for the Yankees last week. So we should have some cool interviews. And we're working on more and more. So it'll be fun, I promise.
Oh, yeah.
Thank you all for listening. God bless you all. The Garden City office is 516-794-0404. Give us a call. We'd love to help you out. If the phone lines are busy, just leave a message on the answer machine. We get so many phone calls throughout the entire day, but also especially when we're doing the program. So, I think there's 6 or 7 phone lines, but we can't pick up every single one. Website, drcalapai.com, as many of you do, thousands of you do. Certainly leave us an email. Give us some basic info. It's hard for me to answer if you write a full page of 100 lines of info. That's sort of difficult, but we can get you set up either for an in-person consult or a telehealth consult. We're doing some great stuff with telemedicine now, especially for Medicare patients. We're looking at administering to people who can't really leave their home, that have significant medical conditions, and we're going to set up something called RPM, remote patient monitoring, so we can check them at home, keep tabs on them, work with their other doctors, be able to send a lab to do blood work at their home to make that part easy, review their blood work, etc. So we're going to do a lot of great things, but we'll talk about that